Assessment protocols for lameness in sows. In this presentation, we will look at the welfare concerns arising out of the lameness in sows, the assessment protocols to help manage lameness, and the economic impact to the farmer due to lameness in sows. Why is lameness important? Lameness is a multifactorial disease which includes claw lesions, fractures, skin lesions, and arthritis. Lameness in sows is quite high, ranging from 8.8 to 16.9%. It can also affect loss of body condition and shoulder lesions in sows. It can also increase the workload for pig producers, including veterinarians, stockmen, and is a single such disease that lameness may affect all 5 freedoms. We can now look at the lameness assessment tree, where assessment protocol for lameness in sows is governed by body condition, skin and leg lesions, shoulder lesions, and claw lesions. We will then further identify each so that we can create an assessment protocol. Our assessment protocol will define welfare criteria for lameness, and later on will define lameness in its broader terms. Welfare criteria, as described by welfare quality assessment protocols, is grouped into good feeding, good housing, good health, and appropriate behavior. Under good feeding, we have body condition scores. Under good housing, we have ease of movement, which defines space allowance, and other facility conditions, including good flooring, fencing, feeder facilities. Under part 3, in good health, absence of injuries, which measures lameness, wounds, tail biting. In this assessment protocol, we did not use appropriate behavior. We did not look at quality behavior assessment, the fear of humans, or any social behavior patterns. Extracting the related welfare quality criteria from the welfare quality assessment protocol, we developed the assessment protocol using animal outcome-based and resource-based parameters. In our developed table for lameness assessment, our first measure is body condition. The score ranges from 1 to 5, 1 being visually thin, less than 10 mm back fat, to a sow that is so fat it is impossible to feel the hip bones. We then look at facility damage and facility condition. If there is no damage, score is 0, and if there is damage, score is 2. We then look at the farrowing crates and the adequacy of the crates for the size of the sow. 0 being adequate, 2 being less than adequate. Measures such as space allowance, shoulder lesions, and claw lesions are then reviewed. Shoulder lesions are monitored for sores that can be seen, and sores that are so deep it cuts into the bone. Claw lesions have scores 0 to 2, where 0 represents no difficulty in walking, and 2 represents that the animal is unable to walk. Flooring is scored from 0 to 4, 0 being part slatted plastic and solid concrete, 4 being solid concrete. We then look at leg lesions, both lower leg lesions and upper leg lesions, between scores 1 to 3, from no blemishes to severe wound. Having discussed the assessment protocol developed, we now look into an assessment scenario. Assessment scenario. A medium-sized farrow to finish farm was surveyed for the level of lameness which its sows were exposed to. 80 sows in early pregnancy were reviewed based on a tailored assessment protocol. This is a fictional case. The following pictures show sows in their group housing stalls. In this picture, we show metal and plastic grating for the sow and the piglet within the confined sow crate. The next photo shows solid concrete flooring together with metal grating. In the next section, we will look at extracts from the developed table for lameness assessment and compare photographs which were taken on site so that we can create a score for the assessment protocol. We will first look at body condition, and the aim is to focus on obesity of animals and its ability to impact its lameness. From the photographs showing a number of pigs, sows, we can see a range of scores from 1 to 5. 1, the sow shows visually thin and a backbone very prominent. 3, which is perfect or desired, it takes a firm pressure with the palm to feel the hip and the backbone. A score of 5, the sow is so fat it is impossible to feel the hip bones and backbones even by pushing down with a single finger. These sows were assessed and documented. We then look at shoulder lesions. The aim is to focus on ability and the presence of shoulder lesions to maintain suitable score. Shoulder lesions, as seen in the photographs, range from 0 to 3. Our photograph number 1 shows it sores in the top layer of the skin. Number 2, it can be seen that a crust formation with a bit of a scar tissue. 2 photographs show score number 3, indicating deep sores and a visible shoulder bone. Claw lesions. The aim is to ensure claws are monitored, ensuring that the animal is free from pain and can achieve a good gait score. Claw lesion description can be toes, dew claws, heel overgrowth and erosion, heel sole crack, white line, crack horizontal wall, crack wall vertical. In this instance, we have photos of white line. To conduct our assessment, we surveyed 10 sows based on the animal welfare recommendation. The results were compiled and put in a table below. In our results table, developed table for lameness assessment, we reviewed 10 sows. Each sow we measured 9 characteristics: body condition, facility condition, farrowing crates, space allowance, shoulder lesions, claw lesions, flooring, lower and upper leg lesions. An average score was determined for each measure and a target score was proposed. From this table we can see there are a number of good aspects and there are 2 aspects that needs addressing. We will now discuss our findings. From the results we can see that the animals had sufficient space, they were in mostly good body condition, and the facility was relatively safe and good. The next, shoulder lesions had been highlighted for improvement. However, sow number 9, there was a high score, and this flagged an area of concern. Claw lesions and upper leg lesions have been identified as areas of concern which may pose welfare concerns. The main factor related to these has been attributed to the type of flooring which has not been recorded in this document. Based on the outcome, guidance notes were prepared for the farmer for future reference. Hock lesions are popular for plastic slats. Epoxy covered cast iron slat reduce prevalence of high feet lesions. Farmers should consider these recommendations for future use. Soil flooring plays a factor in shoulder lesions when sows possess low body score condition. Farmers should pay attention to sows with low body score and cleanliness of stalls. Claw lesions. Claw and foot lesions are extremely common, between 88 to 100% of sows. Not all claw lesions are associated with lameness. In a survey, 67.5% of sows had common foot lesions at the rear, whereas 32.9% had front heel lesion. Cracked hooves were found on the front feet of 22.6% and 80.1% on the rear feet of sows. Body condition scoring. Iowa State University recommended that scores for sows should be analyzed in early gestation. In another study, 9.7% of sows had score of 1, and another study 0.8, a large variance in body condition scores. Sows with low body condition score are subjective to more shoulder lesions. In our note to our farmer, the farmer is to avoid skinny sows through better environment and diet management. Now look at the economic consequence of lameness in sows to the farmers. Lameness in sows reduces the productivity of a unit by reducing sow longevity by increasing the involuntary culling rate of sows by the farmer. They also reduce the number of pigs produced per year. They increase the expenses as a result of the cost incurred in replacing sows, increased workload, reducing the number of finishing pigs reaching the factory. In conclusion, lameness is a multifactorial disease. It affects an animal welfare through pain and suffering. It affects the productivity and impacts the farmer's profitability. Development of simple, reliable, repetitive assessment protocols can allow stockmen to conduct more frequent reviews of sows and possibly keep an animal within the target scores of assessment. The assessment protocols in this exercise only address sows in early pregnancy and will need to be developed for mid to late pregnancy and lactating sows. This is the end of this presentation. Thank you.